questions now are going to Dr. Tamim. We have a question in the chat box from Dr. Hawarman. He asks, is there any data about number of stroke patients in Baghdad city per year?
Thank you for the question. Unfortunately, as my colleagues mentioned in their lectures, the usual incidence globally is about between 100 to 200 cases per 100,000 per year. This is the global incidence. I don't know about any specific data from Iraq, but one point in our protocol, what we are working on in our committee, the Minister of Health, is about stroke registration, and to start in a good way, in right way, with stroke registry. We are working on a software which working online, which can give access for every hospital with online registration of every case of stroke, whether it gets only antiplatelet, medical supportive therapy, or get thrombolytic therapy or mechanical thrombectomy. We hope after starting this stroke registry, after that we will get real data about the incidents. Right now I have no answer for that question.
اوكي بس العفو يعني اذا تسمحوا لي مداخله بالنسبه للانسيدنس يعني احنا راجعتك ويسموه الكتاب الوطني وزاره الصحه اللي هو ينزل كل الداتا الموجوده. العراق مسجل 10 ل 20 الف وتعتبر كلش اندر استيميشن لانه الجزائر تقريبا 45 مليون مسجله 50 الف، مصر 104 مليون او 105 مليون مسجله 200 الف، احنا مسجلين 20 الف. فاحنا عندنا مشكله كلش قويه بالريجستري، واعتقد السبب انه الكيسات يعني اللي صار ستروك قاعد تشخص اما نون ستروك او نيمونيا او كذا او تي اي او something يعني هاي. فاحنا وير ناو انه نحاول انه ناكد على المستشفيات العامه انه تسجل اكثر كيسات الستروك على ما نقدر نحصل خلينا نقول داتا امام الوزاره نقدر نحصل بها ريسورسز ونحصل بها يعني فاندنج او يعني امور اخرى. وبالنسبه لعفو الدكتور علي ولا مداخله، احنا يعني ان شاء الله بصدد يعني تاسيس البرنامج الوطني للسكته الدماغيه. واحده من المهام مالته هي الدعايه اللي تصير للمواطنين، واحده من عندها البوسترات، حتى ممكن نحصل على فاندنج له بوسترات دعايات بالتلفزيون ويا الصحه العامه ويا كذا. اكو يعني باذن الله تعالى خلال هالشهرين يعني 3 راح تخلص شغلات مرتبه وتكون جاهزه بالنسبه لكم يعني جميع العراق انه يقدر انه يتناولها وينشرها. نحاول نعزز المعرفه مال المواطن العادي البسيط بالساين سيمبتومز اوف ستروك. طبعا احنا نحتاج education للدكتورز يعني للكوميونتي بيست هوسبيتالز، يعني المستشفيات اللي هي عامه لكن قد تكون تحتاج الى تثقيف وإديوكيشن، خاصه هالمستشفيات اللي صارت قريبه من البيوت. هاي هم اكو بروجرام لها راح يصير انه يعني نعم
اتجاه التثقيف. اقول لك هاي احدى الخطوات ان شاء الله في Iraqi Stroke Network، وبعد يعني المجهود الكبير هو على جنابكم باللجنه، بس هاي احدى الخطوات ان شاء الله.
ان شاء الله، فان شاء الله جاي الخطوات باذن الله تعالى.
Next question for Dr. Tamim. What are the most important obstacles in applying stroke program, and what is your advice to overcome them?
هذا أهم سؤال وهو المشكلة الحقيقية. الأوبستكلز عندنا هسه احنا كنا كأطباء، أنا راح أحكي بالعربي عمود ناخذ راحتنا بالكلام. احنا كنا كأطباء نعرف انه الactivity is indicated for about more than 10 years now, and it is available in every hospital and every emergency department and every CCU. It is available, and we have the knowledge, and we know how to diagnose the stroke, and many patients they are reaching in window. It's almost every hospital with the surface of neurology, they have a CT scan most of the time. But the most important problem, the doctors afraid from using activities due to the possible complication, although it is very not common, at least it's maximally 3% maximally. But when it occurs, they are afraid from the response of the family. because in general situation in Iraq is not protecting doctors. If there is something happen to the patient, for example, if we have 1% mortality due to massive symptomatic hemorrhage, no one will protect the patient, the doctors. That's the major step. That's if you ask your colleagues throughout all Iraq, they are mostly using the activities with their relative and their friends. They are happy to do it because they feel secure when they are using the activities with their friends and colleagues and doctors especially. But with the foreigners, they are very restricted in using it. And that's why when I am asking my colleagues to participate in this work, to start to encourage to increase use of activities, most of our colleagues refusing starting using activities due to the general situation in Iraq. The Ministry of Health regulation, they are not supporting the doctor. Any patient would go to claim to the Ministry of Health about some doctor, they will say, this doctor is not listed in our drug list. Why you give activities? That's why we go to the Ministry of Health. We all go from top to base, not from base to top. We go to the Ministry of Health. We speak with the ministry and the board members. And the starting point is to protect our doctors by guidelines, by local Iraqi guidelines. After that, we start to organize the right way. We should organize the stroke unit for strict follow-up. And after that, I think there is, even if 10% only of neurologists start using it, and with the progress about 10% every year, so within 10 years, we will get 50% or more of doctors using activities for acute stroke.
Okay, thank you, Dr. Tamim, for your participant. And now the question in the chat box goes to Dr. Ahmed. Please, Dr. Ahmed, talk about your opinion about using a lower dose, like 1.6 milligram per kg. It was using in several studies in China and Japan, which has lower risk of hemorrhage with the same benefit.
Yes, there is such research, but unfortunately, it not reach an evidence base. The evidence base thrombolytic therapy is only 4.9 milligram al kg. Other doses are used only for investigational purposes. They show promising result with less side effect, but is not proved yet. Maybe if they take larger number with and perform randomized controlled clinical trial, and if they show benefit, maybe approved in the future.
Excuse me, can I answer? I have a comment on this question.
Yes.
There is Enchantis trial, which is a trial in Chinese about the low dose 0.6 milligram per kg of RTPA, but it showed lower
efficacy.
Lower efficacy than 0.9 milligram, although there was a lower number of hemorrhages, but it shows lower efficacy than 0.9 milligrams. So the guidelines and the FDA approved the 0.9 milligram per kg dose for the treatment of acute ischemic stroke.
Okay, for the questions, there were no questions left in the chat box. Thank you for all.
Thank you very much.
Dr. Mustafa, if you could unmute yourself, please.
Sorry. Thank you for all attendees. Thank you, everyone. We thank especially Professor Sarmad Al-Fahad, Dr. Mutaz Fayrooz, Dr. Tamim Al-Tamimi, Dr. Sarud Nizar, Dr. Ahmed Al-Salim, and finally Dr. Hassan Abdul Rasul for their participation in this webinar. And we also invite you to follow us on social media. On YouTube, we will download or we will upload the lectures on YouTube channel. We have a specific email and the Instagram and Facebook page, in addition to our Telegram channel. And finally, we again invite you to join us by filling this Google form and waiting your valuable contributions to develop the work of this network. And last but not least, we would like to invite you to our next event. It will be on land, it will not be virtual, will be in Baghdad hopefully, and we will tell you the date as soon as we prepare the logistic issues. Thank you everyone, and have a good day.
Mr. Dr. Mustafa, sorry to coming late. I don't know if I have 2 minutes from your participant,
Okay.
just for contribution. This is Dr. Al-Rikabi Aksam. Maybe some of you recognize me. I am a graduate Baghdad 1993. I'm a consultant stroke in UK. I just want to contribute for 2 minutes. Thank you for the invite.
You're welcome, sir.
And yeah, and when we are using Altablaze, myself, I use it in the last 13 years. There is no harm. It's a very safe medication to overcome the Iraqi environment and circumstances. I think consent, family agreement should be in place so you reduce. Safe practice, we have to set a protocol for needle, door to needle, and call for needle as well, which make it strictly 1 hour for door to needles, and call for needle will be 4.5 hours. Advanced imaging will reduce risk of bleed, risk of death from bleed on trials of Altablaze trial, which is very low, it's 0.8%, and mortality of this 0.8% is around 2%. It's tangible. We haven't recorded much death in our center from using Altablaze. It's required to develop protocols. You need a good ED first, which is the ED does mean the team in ED emergency department to be familiar with using Altablaze. In UK, it is not in house officer level. It is registrar or consultant level administrate Altablaze. And I think this is the best step. You start with it to develop ED for stroke, and then you step up with that one. And this is including level A, we call an emergency call for ambulance to bring patient within 15 minutes to the emergency. And to proceed further, it take a lot of work. As I'm attending in Erbil in February to conduct the trainings. I'm a course lead for thrombolysis trainings with second international Howler Medical School. I'm going to do a training course. If anybody interested, I'm more than happy. I'm from the Basra, so Ahmed, he knows me. I'm from Basra. And also Hassan, he knows me. I'm a graduate from Baghdad. I'm more than happy to help to set any sort of protocols, safety protocols and administrative protocols. And it take us, just to aware, it take us 10 years to step in from thrombolysis as Altablaze to thrombectomy, mechanical thrombectomy. So never feel low or you are behind. Starting it is starting in the service very important. And I'm happy to liaise with you. And also I have a connection with the International World Stroke Organization, as they are overlooked about cancer, about centers, and they are certified center, and they help a lot in these matters. Thank you for allowing me this one, and it's a pleasure to meet our Ustad Kabir Sarmad Al-Fahad and all the participants, and thank you very much to allow me to have these 2 minutes. I apologize for the noise. I'm talking from street, so thank you very much indeed.
Thank you very much, sir. Thank you for this valuable information. We should keep in touch, sir. We should keep in touch. And finally, we would thank مكتب المعمورة Dr. Alim and Dr. Humam, who hosted this webinar, and we thank them again, and we notify that our next on-land on-land meeting will be advocated by the Abdi branch.